Good afternoon and welcome to our congressional briefing and national webinar to celebrate 25 years of the racial and ethnic approaches to community health programs. Today's event is hosted by Trust for America's Health, or TFAH for short. My name is Tim Hughes, the External Relations and Outreach Manager at TFAH. We would like to thank our speakers and audience for being with us today. Real-time captioning is provided today by Caitlin from AI Media. For captions, click on More at the bottom right of your screen with the three dots. Next, click on Closed Captions. ASL interpretation is also being provided today by Maria and Brianna with Keystone Interpreting Solutions. If you would like to use ASL interpretation, hover over your cursor over the interpretation button on the bottom of your Zoom screen. We encourage you all to share your thoughts and questions about today's presentation by typing them into the Q&A box. We'll try to answer as many as we can as time permits. To open the Q&A box, click the Q&A icon on the bottom screen. From there, select Enter when you are ready to submit your question. And now it is my pleasure to introduce the moderator of this event, Dr. J. Nadine Gracia. Dr. Gracia is the President and CEO of Trust for America's Health. She is a national health equity leader with extensive leadership experience in federal government, the nonprofit sector, academia, and professional associations. As President and CEO, she leads TFAH's work to advance sound public health policy, address the social determinants of health, advance health equity, and make health promotion and disease prevention a national priority. Welcome, Dr. Gracia.
Thank you, Tim, and thank you to everyone in our audience who is joining us today for this really important discussion. As Tim stated, my name is Nadine Gracia, and I have the honor of serving as the President and CEO of Trust for America's Health. I certainly want to first start out by welcoming all of you in our audience and thanking our esteemed panelists for taking the time to participate in today's briefing and webinar. It's such a pleasure for Trust for America's Health to host this webinar in commemoration of the 25th anniversary of the Racial and Ethnic Approaches to Community Health, or REACH program, and we're honored that you're with us today. Next slide, please. So here you see the agenda for our webinar today. We're going to begin with an overview and introduction, and then move to our panelist presentations on the REACH program. We'll then have time for questions from our audience. So I encourage you, please do submit your questions in the Q&A function. You can start submitting right away, and we will get to as many questions as possible. Next slide, please. So for those of you who may not be familiar with our organization, I'd like to briefly introduce Trust for America's Health, which is commonly known as TFAH. We are a nonprofit, nonpartisan public health policy, research, and advocacy organization that promotes optimal health for every person and community, and making the prevention of illness and injury a national priority. One of our longstanding priority issue areas is obesity and chronic disease prevention. And over 20 years, TFAH has released an annual report called The State of Obesity, which analyzes the latest data on rates of obesity and provides evidence-based policy recommendations to address these issues. There's a full list of our policy recommendations in the State of Obesity report, which includes, in particular, our recommendations to strengthen and expand the REACH program, which is a priority issue area for us. And our report can be found on our website at tfa.org. Now, before we transition to our panel, we will start with just a brief overview of the REACH program, and you're going to hear more about the program in depth from Dr. Peterson and an example of what's happening in community from Paula Chrysler. But I'll just give a brief overview and really explain to why we believe that it's so critically important for improving and advancing the health of communities across the nation. Next slide, please. So, as many of you know, many factors really can influence and contribute to what we see as health disparities, including access to healthy and nutritious food, high quality education, housing, income, and many other factors. Many factors that influence a person's ability to live a healthy life, some of which are really not in their direct control. For example, a person may live in a low-income neighborhood and is less likely then to have access to a full-service grocery store that consistently offers and carries fresh fruits and vegetables. Over time, these types of structural differences and barriers have truly played a significant role in creating the health disparities that we see today and have seen over decades. The chart on the right of this slide, it shows the rates of obesity among Asian, Black, Latino, and white adults. And Dr. Peterson is going to talk a little more about these data in particular. And you also see the disparities that exist among some population groups. There's also a higher prevalence of other chronic diseases among some populations of color, including higher rates of diabetes and higher prevalence of hypertension. And these are some of the key ways in which, when we think about the REACH program, working to prevent chronic diseases really has such an important role to play. Tobacco use, another example, has been found to be one of the primary drivers of cancer-related disparities because of the populations that it disproportionately impacts. And as we can see in this chart, in addition to the impact on people and people's lives, these disparities also have economic consequences and costs. There's a recent study in 2022 that estimated that health inequities cost the US about $320 billion in annual healthcare spending, and that could increase to over $1 trillion by 2040 if left unaddressed. Next slide, please. So this is a milestone year that we are excited really to join in the commemoration of. 2024 marks the 25th anniversary of the REACH program, truly a remarkable achievement. Since 1999, the REACH program has focused on reducing disparities in the rates of chronic diseases for specific racial and ethnic groups in communities. And over that time, REACH has worked with more than 160 communities to help make healthy choices more accessible and easier. REACH grantees plan and carry out locally driven, culturally appropriate programs to address the root causes of chronic disease and reduce health disparities among people who are African American or Black, Hispanic or Latino, Asian American, Native Hawaiian, Pacific Islander, and American Indian or Alaska Native. Now, REACH grantees, understanding their communities, choose which groups are disproportionately, the groups that are disproportionately impacted that they're going to serve, and what interventions they will implement to have the greatest community impact. The Centers for Disease Control and Prevention is currently funding 50 organizations in 32 states and DC to carry out the current 5-year grant cycle. And these grantees truly are often trusted community leaders that have experience working with priority populations. The current grantees include community organizations, colleges and universities, health departments, localities, and tribal organizations. And you'll hear more from Dr. Peterson about some of the program accomplishments and strategies in her remarks. Next slide, please. Now let's look at the federal funding for the REACH program, something that certainly our organization pays very close attention to. Starting in fiscal year 2017, the REACH appropriations line has also been set aside to specifically support the Good Health and Wellness in Indian Country and Healthy Tribes programs. So what you're seeing here is the appropriations amounts for the total REACH funding line, including the Good Health and Wellness in Indian Country, which is also known as GWIC component. And on the chart, you'll see that the blue component of the bars represent the REACH program. The orange represents the Good Health and Wellness in Indian Country program. Both of these programs have seen incremental increases over the past 5 years, but they are often, unfortunately, slated for cuts in congressional appropriations bills. For example, under the proposed fiscal year 2025 House version of the Labor and Health and Human Services Appropriations Bill, funding for the REACH program is proposed to be decreased by $6 million, while funding for the Good Health and Wellness in Indian Country program would increase by $6 million. And I want to underscore this following point. It's really important to know and understand, if we can go to the previous slide, thank you, that these two programs are complementary to each other. And we at TFAH strongly believe that these programs both need and should have additional funding, but these programs should not have to compete with each other for that funding. And while we're relieved that REACH and the Good Health and Wellness in Indian Country funding have been relatively stable over the past few years, the ongoing threats to funding really make it challenging for grantees to achieve their goals. And overall funding is also not even keeping pace with the community demand or the increasing rates of preventable health disparities. Next slide, please. Now, what you're going to hear today is really about the proven track record and the accomplishments and the work of the REACH program and its grantees. And with its proven track record, the REACH program is in a key position to prevent and address increasing rates of chronic diseases. You can visit the REACH website, which has many success stories listed from the past decade, a few of which are highlighted here. And I know that our speakers are going to highlight some of the tremendous impacts of the program as well. And REACH is focused and it's designed to impact those structural factors that have a large influence on health. And by providing trusted community organizations with the resources they need, those organizations are really primed to make an impact in their community. However, as I noted earlier, we know that there's not enough funding given the rates of disparities and the number of communities that have actually applied for REACH grants. In just the latest cycle of funding, there were more than 130 applicants who were approved but did not receive awards because of the scarcity of resources. And these communities truly should be awarded the resources to give their residents the best opportunity they can so that they can be healthy. Next slide, please. Now, before we move to our panelists' presentations, this is indeed a virtual congressional briefing and national webinar. And so we wanted to take a moment to honor the late Congresswoman Sheila Jackson Lee. Congresswoman Jackson Lee was a powerful advocate for many programs that sought to address health disparities, including the REACH program. And without her leadership, the REACH program would not have achieved this critical anniversary. So I'd like to ask everyone if you would join me in a moment of silence in Congresswoman Jackson Lee's memory. Thank you very much. We are now going to move into our program with our featured speakers who will provide their presentations, and then we'll move into a discussion with our audience question and answer. Our first speaker is Dr. Ruth Peterson, who is the Director of the Division of Nutrition, Physical Activity, and Obesity at the Centers for Disease Control and Prevention. The division provides national leadership on nutrition, physical activity, and obesity prevention through policy and guideline development, surveillance, epidemiological and behavioral research, and technical assistance to states and communities. Throughout her career, Dr. Peterson has drawn on her expertise in patient care, health system change, disease prevention, and community engagement to develop and guide programs, research, and policy to improve health behaviors, reduce health disparities, and reduce chronic disease. We are also delighted to be joined by Paula Chrysler, the Executive Director of Healthy Savannah and the Project Director of the YMCA of Coastal Georgia's 5-year CDC REACH grant to reduce health disparities in Chatham County, which was renewed for another 5 years from 2023 to 2028. She works daily with leaders and grassroots community members across all sectors to help make the healthy choice the easy choice. Without further ado, it is now my pleasure to welcome Dr. Ruth Peterson from the CDC, truly a champion for the REACH program and for all of the work that she leads on nutrition, physical activity, and obesity at CDC. Dr. Peterson, I'll turn it over to you. You are on mute, Dr. Peterson, if you can unmute yourself.
Thank you so much. It is a pleasure to be here with all of you, and I appreciate TFAH's leadership in this. And we're celebrating an important birthday today in this 25th year of the racial and ethnic approaches to community health. And we're pleased to have this program run out of our division at CDC. Next slide, please. Dr. Gracia has mentioned some of this, but just to echo and focus and really bring this to your attention about health gaps that exist among racial and ethnic minority groups. And we know that these groups have higher rates of disease, they have early death, they have increased healthcare costs that not only are reflected in their own individual costs, but in the country's costs, and they have a lower quality of life. So all of that is critical as the premise for why REACH has been around for 25 years to address that. Next slide, please. Unfortunately, we pay the price for these disparities between the different groups that have a higher burden of chronic disease. If you look at the cost broken out by behaviors, we can see that low rates of breastfeeding lead to $3 billion of healthcare costs for mothers and children. Inadequate physical activity adds $117 billion of cost in healthcare, and $173 billion are in obesity-related healthcare cost. But the main point here today with this talk is that these are preventable, and the REACH work is a key cornerstone in addressing progress. Next slide, please. Dr. Gracia mentioned already our work on tracking obesity rates across the country. This is an example of what the REACH recipients use when they apply for grants. So they look at the data about where the burden for chronic disease is the highest, and obesity is one of those chronic diseases that they use in their data points to respond to the competitive funding that we have available for their work and their action. This is the overall map of the United States. The darker the color, the higher the prevalence of self-reported obesity in adults. And this data is from the Behavioral Risk Factor Surveillance System from 2022. Next slide, please. This next slide shows you the breakdown, as Dr. Gracia showed you in one of her graphs as well. When you split apart the reports of obesity in adults by racial and ethnic groups, you can see how that switches on the geographical location and also on the amount of obesity in each one of these groups. You can find this on CDC's website as well as obviously on TFAH's State of Obesity Report. So please refer to that as needed. Next slide. So that's the bad news, that's the burden, that's why we're here, that's what we're going to change. And we do that because REACH really uses these culturally appropriate programs and proven strategies. We're not doing stuff that is not evidence-based. We know what works because we want to improve health, we want to prevent chronic disease, and we want to reduce those health disparities. Next slide. And as has been mentioned, we have the recipients for REACH, again, pay attention to their context. So use these culturally tailored interventions. And Dr. Gracia has already listed this list for you, but these are the interventions that we work with them on, again, based in evidence, but culturally tailoring them. And I will speak more to them in a few slides, but just to give you the overview here on food, activity, breastfeeding, early care and education, family healthy weight, and tobacco-free environments. Next slide. So REACH recipients do not act alone. So this is a cooperative agreement with CDC. So we are all in each other's business, and we are really working on promoting what we know works in a culturally tailored way with community engagement. But communities are not isolated. There's not one or two people that define a community, because you have to pay attention to all of these boxes and many more that each recipient really works with at the ground level: healthcare, housing and development, land use and community design, business and industry, transportation. These are critical players that each REACH recipient really engages with through their community and their connections. And there's a bi-directional feedback between what's happening for CDC, with the REACH recipients, with the community engagement, and with these partners. Next slide. So REACH is one of the only CDC programs that focuses on reducing overall chronic diseases among these specific racial and ethnic groups where the burden is the highest in urban and rural and tribal communities. Next slide. So Dr. Gracia mentioned the appropriations. This is from back at the beginning all the way up to the present day, and you can see the peaks and the ebbs and the flows. And I would just echo here that Dr. Gracia is right. The demand for these programs far exceeds the available supply of funding. Next slide. So we know since 1999, REACH has shown that locally based, culturally tailored solutions can be effective. Next slide. We've had 25 years of REACH recipients, and you see them here with the dots. 240 recipients over 25 years, with 160 of those being unique. I want to turn now with the next slide, please, to the last 5 years of funding. Dr. Gracia mentioned we fund in 5-year increments. So we had the dots here illustrate the last 5 years of REACH recipients from 2018 to 2023. And keep in mind that we look for a geographical spread, and we also look for spread across the different racial and ethnic groups when we make award decisions. So next slide, I want to show you that we actually have incredible impact from the 5 years of these REACH recipients that you see here. And while these may just feel like numbers to you, I want you to understand that behind these numbers are real people, real communities, passion from all those sectors I showed you about to make the secret sauce to make this happen at the ground level. We have almost 9 million people who have more access to safe and convenient physical activity across this country. Over 1 million people through the REACH work have now healthier foods because of healthier nutrition standards that were put in place in their community setting. We have over 2.3 million people who have increased access to food systems that are helping them get increased fruits and vegetables, increasing healthy foods, having incentive programs for fruits and vegetables, and working in concert with our sister agencies, including USDA, SNAP, and WIC. We have over 1.1 million people who have breastfeeding support when they leave the hospital. We want women to meet their breastfeeding goals. And when you leave that hospital, you need support in your community. We have over 1 million people with now tobacco local policies that prevent any exposure to smoke and secondhand smoke. And we have almost 50,000 patients who have had an increased linkage from their community into a healthcare system. Next slide. So this is huge. I'm going to give you 2 success stories. Paula is going to give you some real life success stories, so I'll be brief. These are just examples. And as Dr. Gracia mentioned, you can find all of these on our website. So a nutrition security success that aligns with our Food as Medicine initiative in this country is in the Greater Flint Health Coalition REACH program that partnered with the local temple and a food bank and implemented a full service indoor food pantry and supported biweekly food distribution and served over 1,000 families in the 1-year period between 22 and 23 to people who were experiencing food insecurity, including seniors and families. Next slide. The next success story is around active living, and Stockton REACH partnered with Girl Trek. If you don't know about Girl Trek, please check into that. It's an amazing group of individuals who are actually acting at the ground level to support physical activity, health, and well-being for Black women and girls. And Stockton rolled out this program in 2022 to 2023, and 92% of respondents said they had increased physical activity, which leads to increased health, increased well-being, increased social connectedness, and you see that reported also in the data from them. Next slide. So currently funded. Here are the dots for the 50 recipients we now have funded. They're just getting ready to start year 2. It's 2023 to 2028 for their funding. And again, to keep reminding you, this work focuses on improving health, preventing chronic diseases, reducing health disparities among those racial and ethnic groups in these urban, rural, and tribal communities that have that highest burden of chronic disease. They submit applications with data to show us we have a disproportionately affected group in our area, and we are going to work on improving their health and improving their well-being with the evidence-based strategies that are culturally tailored. Next slide. So I said I would talk a little bit more about what we do. So I could talk all day about this. And so I'm going to be very careful to be very high level, and we're always able to answer questions. But when you think about the program strategies that we're asking people to do, it really is hard work. But we know that it works. So we need communities to improve the design of their communities to increase access to physical activity. We want to promote healthy food, service, and nutrition standards, expand fruit and vegetable voucher and prescription programs, establish continuity of care and breastfeeding support, implement tobacco prevention and control policies, integrate obesity prevention standards into early care and education, and advance our farm to early care and education work, which again fits with the Food as Medicine and the life course perspective work that we do. We want to support the rollout of family healthy weight programs, and through our partners in the Immunization Services Division at CDC, we want to increase equitable access to vaccinations for adults. Next slide. When you look at the number of current recipients we have and you ask who their priority populations are, it's very important for everyone to understand. You can pick more than one priority population, but you need to make sure that you designate how you're culturally tailoring to each one of those audiences. So when you look at our recipients, 37 recipients are prioritizing African Americans, 2 Alaska Natives, 9 American Indians, 2 Asian Americans, 34 Hispanic Americans, and 3 Pacific Islanders. Next slide. I also want to give you a breakdown of our urban, rural, and tribal settings. So among our current recipients, we have 76% in urban settings, 14% in rural settings, and 10% in tribal settings. Next slide. Thank you for your attention. I am so excited that you'll hear from Paula next as an illustration of the work that we fund through the congressional line at the ground level. And please feel free to get in touch with me in the future. CDC Washington is the best direct connection for that, and their contact information is here. And I will turn it back to Dr. Gracia.
Thank you so much, Dr. Peterson. What a powerful presentation showing the scope of the program and the impact that grantees are having in their communities, really, really to the benefit of the health of so many millions of people across the country. We are now pleased to turn it over to Paula Chrysler, again, from the YMCA of Coastal Georgia's REACH program. And as Paula is presenting, please do continue to put any questions you have in the Q&A feature. I'll now turn it over to Paula.
Thank you, Dr. Gracia. And Dr. Peterson, you set us up very, very well here. So good day, everyone. I am Executive Director of Healthy Savannah, but we partner with the YMCA as their fiscal agent to bring these funds to Chatham County and the city of Savannah. And we are just super excited. We're so grateful for these resources. Healthy Savannah started 17 years ago, and it was 18 years ago that our mayor at the time, Dr. Otis Johnson, had a heart attack that was serious. And he's a tall, thin Black man. And he said, if this can happen to me, this can happen to my entire community. And so he was the one that planted the seed. And there were a few very early adopters when he said, let's start something called Healthy Savannah. So we did. And we are grateful for the YMCA that they came along when we applied for this funding to be our fiscal agent and move things along for us. So next slide. Many of you have seen this somewhere before but we are totally embrace this space. If you want to go fast, go alone. But if you really want to go far, you really go together. And it's probably the best motto for Healthy Savannah, because we are a collaborative coalition, over 200 public-private partners across all sectors. We call ourselves sometimes a non-neutral or a neutral convener because we are about everyone. So and we have become a trusted organization, as was noted before, in our community. The mayor calls us all the time about stuff, and Chatham County Commission and the school district and the hospitals. And so we truly are a trusted voice in the community. So next slide. This is our team. So I just want to say, with the funding that we received over 5 years ago now for our first REACH funding, I was able to bring on a team because I was there as a volunteer, kind of maybe a little bit of a stipend staff person for a very long time. But my passion is bringing health into, to just bring a culture of health to our community. But I've been able to bring on young folks, most of whom have shared experiences with the folks that we're trying to improve their health outcomes overall. So excited to have this team, and we're doing some really good work. Next slide. So our 3 strategies that we are working on are physical activity, nutrition, and breastfeeding. And so we're going to start and go through some data relative to everything, and you will see more than one selfie as you go through here. That social connectedness, we started what's called the Healthy Walk in March of 2020. And everyone knows what that month and day means. But we just said we've got to get out and stay active regardless of what's happening out there in the world. And so, of course, we masked up, stayed distant, and we were early adopters of the Active People Healthy Nation program. And so we have our design elements for Healthy Savannah and Healthy Chatham, our county. So this is just a group of us one Tuesday morning. If you're ever in Savannah on a Tuesday morning, 7:30, come join us. We'd love to have you. Next slide. All right. This first graph just shows about the Tide to Town Trail System, which is a 30-mile loop that's going to be built. Currently, we have 3 miles of it, and we just broke ground. You'll see a photo in a second of the next 3 miles, but it's going to be a 30-mile loop around the city that's going to go through neighborhoods of our priority population, which are the Black and brown folks in Savannah, and it's going to increase access, obviously have transportation access going to schools and to shopping centers and to hospitals. It's going to be a non-motorized transportation trail. So this has been a concept for a while. And as you see, these graphs are very flat in terms of how often you think people are going to be on a 3-mile stretch. Not that often right now, but we're building it. And so the next section here, please just go ahead and click through for a next graph. There we go. So we're super excited about this, but we have work to do. Have you heard about the Active People Healthy Savannah Initiative? And since 2019, when we adopted it, 14%, but now that has doubled to 28%. So we're very, very, very excited about the facts that people that are knowing and know that when we do these surveys, we are only going into our priority populations. The data bears that out, that are the folks we're trying to focus on when we applied for this funding we're listening to them as we go along. Next slide. Okay, this is our at our groundbreaking. This is our current mayor, Van Johnson, and yes, he does call and says Paula, and we are out there in force all the time. And he's super excited that we're on board with everything. And this is the Tide to Town 30-mile loop, so yeah, it was a great day. This was a month ago. Next slide. The only thing up here that I want to focus on is the upper left corner. You see our Healthy Walk locations. If you go to the healthysavannah.org website, you will find an interactive map there that shows where we've been. It gives you like where to park, what the trail's like and how long it is and things like that. But it's just an opportunity for people to go and say, yes, I can be active in the community and it's something that's near me. And we have clearly, that far west one on the right-hand side is Tybee Island. We get out there about once every 6 months, and it's always fun to walk on the beach. And this is an example. It's actually a walk around Lake Mayer one day. So next slide, please. Okay, selfies, you've seen them before. We do have fun. This is the June photo of the Savannah Chatham Food Policy Council. And you will see there too, we have folks from across all the food system places. We have doctors from both of our major hospital systems engaged, but then we also have community members just across the board. Again, we are, it's just a lot of folks. And what we're trying to do here is really, again, bring forward to our elected officials, educate and bring awareness to them on things that we can do all collectively together to close the gap around access to healthy, affordable food. Next slide. So the first thing, actually, go ahead and move through this to the next graph, because these two graphs are very similar. And all I want to do here is call attention to the trend over time, 2019 to 2023. You will see those lower numbers. How often do you eat fruit? That's the top, and in the bottom, vegetables. And the impact that we're able to have because of these resources is evidence right here in front of you that says people are eating more fruits and vegetables. And because we're out there talking about the value, doing all kinds of amazing things that are funded through REACH. And I'm just so excited about the increase in consumption overall. Next slide. And go ahead and go through to, yeah, there we go. So we just did a quick landscape assessment earlier this year, and these are all at food pantries, even our largest one, Second Harvest, where we asked, what do you prefer? And this fresh is the green, frozen is the blue, and canned is the yellow. So people want fresh food. That's what they want, and we need to be able to provide access to that. Next slide. And part of the way we're doing that, and so this was mentioned earlier in one of Dr. Peterson's slides, we have had a very active Faith and Health Coalition before we had REACH funding. And right now we have 19 faith-based organizations that have participated in what's called the Faith Activity and Nutrition Training. It's module-based, and what it does is it brings people to the congregations to place where they can offer not only their organization, but the folks that they serve, because a lot of faith-based organizations have pantries as well and trying to get healthier fruits and vegetables and other food out to them. And this is, I call this kind of our merge strategy because it covers both nutrition and physical activity together, faith activity and nutrition. And so every year we do what's called a faith walk, and we have healthy food and we go for a walk at the same time. And it's supported a lot by the community. Next slide. Okay, last strategy, breastfeeding, continuity of care, so important. The data is clear. Dr. Peterson was one, she was like $3 billion. Just if we can do this, then that's a lot of money. There's a lot of money on the table by just bringing forth healthier choices and having resources available to our community. And so next slide, please. So I'm just going to read this. This is from Dr. Nandi Marshall. She's at Georgia Southern University, and she's been a big supporter of Healthy Savannah and breastfeeding for a long time. But she says there are many struggles when parenting, but breastfeeding doesn't have to be one of them. We are working to connect families in the Savannah area, particularly in the Black and Hispanic communities, with the tools, skills, and knowledge to support their families at home, work, and in the community. Strategies include community conversations, support groups, and education focused on the PUMP Act, which provides employee protection for pumping at work. Next slide. So this is a new strategy. It was a sub-strategy of the nutrition strategy in our first iteration of REACH funding. But now we're asking, getting a little more into, I don't want to call it the weeds, but it kind of is. But the question here is how supportive, how important are supporting breastfeeding policies and places for breastfeeding. So you see, we have a lot of support out there, which is the good news, but then we definitely have opportunities here to change that. And so the next slide will show you a little bit, which again is really good news for us because there's a lot of work to be done, because we know that there are organizations, there are PUMP Act eligible places of employment that that need to be able to provide a space, provide time, provide support for breastfeeding mothers. And so the community, though, thinks that Savannah-Chatham County is supportive of breastfeeding parents. And so that they feel like that is just going to help us do our work better. Next slide. So, and keep scrolling there, that just hit it. Next slide one more time. Because what I want to do is just say, next steps is something that we're always asking at the end of every meeting. It's what we do. And so for year 2 that Dr. Peterson mentioned that we're about ready to head into in October, focus groups, interviews with medical professionals, focus groups with fathers in breastfeeding families, and then really important, the mapping of lactation support resources in our area and providing those things right there, because what we do know, there are a lot of resources out there, but people just don't know about them. And I'm going to, these next steps help close the gaps overall. And so that mapping of the resources takes us to the next slide. And so we've been asking, this is just for last year though, how do you want to learn more about healthy living, healthy services and policies? And social media has been out on top forever. the newsletter. So these are the things that we do. So go follow us on Instagram, like us on Facebook. We're out there. Just go to the Healthy Savannah website and you'll find those icons. We've got a pretty robust website and social media pages that we work with all of our partners to push all of their work out. And so not that we don't do any of these other things, but those are the ones that we focus on. But again, we're listening to the community and saying, how do you want to hear about this? And that's what we're doing. Next slide. Again, where to next? These are questions that we just asked. We had big strategy meetings across all three strategies, and what worked well, what needs more support, where do we want to be, and what's your organization going to do that's going to help us reach that goal? So again, because remember, if we want to go far, we go together. Next slide. And we were excited in 2022 to receive the CDC's Lark Galloway Gilliam Award. And that was in July of 22. And this is the Healthy Savannah Board that's was on the day that oh, look at that. I still got that on that same pink jacket. How about that? Didn't realize that. But anyway, short story here. I just want to close with saying that this team, with your support, will continue to reduce chronic disease burden in our community across the state of Georgia and the United States. Next slide. Thank you.
Thank you, Paula. Just what terrific, the partnerships, the engagement, the community engagement, the way in which you are really hearing the needs of the community is clearly reflected in the work that you're doing each and every day. Thank you so much for sharing your work, and looking forward to talking with you more about it. So this will conclude our panelists' presentations, and we're going to now open it up for Q&A. And just again, a reminder to submit your questions to open the Q&A panel and type your question to all panelists, and we will get to as many questions as possible. I'm happy to be joined now by my colleague, Madison West, who is the Government Relations Manager at TFAH, and she manages our advocacy portfolio on chronic disease and obesity prevention. She's going to help to moderate our Q&A. And while we get ready for some questions, wonderful, we're starting to see some in the chat. I'm going to just toss out a first question, and we'll move to some audience Q&A. Dr. Peterson, you talked about the program strategies, in particular around this current cycle of the REACH program, and thinking about these 25 years of the program. What would you say have been kind of what you've seen as an evolution in terms of what's been most successful, where you're seeing an increased need for focus of the program as it's evolved over these 25 years?
Well, thank you for the question. And I think it's such a great patchwork quilt that we have. So the REACH recipients, again, they pick the population that has the highest burden of disease, and then they use their community context and partners to decide which evidence-based strategy that's already been proven to be effective they would like to implement. So, and Paula's example, like they pick 3. There's a selection they can pick from. So we've got front runners who we see amazing changes, say, in the early care and education guidelines that have obesity prevention standards, which isn't something you would think that a REACH recipient would be doing, but we see at the local level, you start to drive policy that changes how early care and education centers set up food for children, even gardens for children to grow fruits and vegetables, share with their parents. We see how there's changes in sleep, that sleep is really important for disease prevention and obesity prevention. And they change the time frame for when the infants and children sleep. So we have front runners in every strategy that we bring back then, because CDC is sort of this nexus where all recipients can learn from a lesson learned from someone else. And we share that in a bi-directional way through our project officers and through our sort of communities of practice. So there's success stories everywhere that we hold up as illustrations of the very best that can be in it. But we pay attention to the fact that the ground context is always different. So if we tried something in one community versus the other, it might not work unless you have all that secret sauce over here. So we also try to define what is the secret sauce and how can we spread and scale that.
Excellent. Excellent. Thank you, Dr. Peterson. We've got great questions coming in, so I'm going to turn over to Madison to kick off some of the audience Q&A.
Thank you so much, Dr. Gracia. Dr. Peterson, this first question will be for you. Would you please discuss how the Division of Nutrition, Physical Activity, and Obesity is aligning the REACH program with the 2022 National Strategy on Hunger, Nutrition, and Health?
Thank you. What a great question. And so the National Strategy on Hunger, Nutrition, and Health that is now coming up to another year anniversary here, almost at 3 years, is something that the U.S. government takes very seriously. And in DNPO, we take it very seriously too. We're very engaged in the development of all the pillars. So we specifically have, again, we know things that work. The White House strategy brings those forward. So we have Family Healthy Weight Program in the national strategy. We have early care and education. We have continuity of care for breastfeeding. We have nutrition standards that not only implement at the ground and state level, but also even at the federal level. So our food service guideline work. So we're one with that. That is like our speed dial. We pay attention to the strategy. We're very pleased that even with the name nutrition strategy, they included physical activity from the White House because they realized the risk reduction that would have for chronic disease and for improving well-being and wellness. And Paula gave a great shout out to Active People Healthy Nation, which different people have embedded in their communities and co-branded. And that itself is in the national strategy. So great question. It's a Bible for us. We use it all the time. And we were really thrilled to have the administration help us put that document together for a U.S. government approach.
And if I could add here too, Healthy Savannah is one of the organizations that was acknowledged was one. We submitted our commitment, and it was the Savannah Chatham Food Policy Council was what we put forth as our commitment to be part of the strategy. And so we were super excited to be selected, and yeah, it's great.
Fantastic. And Paula, this next question will be for you. Would you please discuss the way that you work with the local health department in Savannah, and also the importance of coalitions and working across different sectors for your work?
So here's the one thing that I always do. I say, this is the phone for Healthy Savannah, because that's what it's been forever and ever, because we don't have a storefront. We are a coalition, and our health department in particular, they offered us offices early on before REACH. And so we work, we have a health department member of our board, and we are totally integrated in their WIC strategy and their immunization strategies. And we're like one. We trade back and forth all the time. They need someone to present out someplace, and they're like, hey, can you do that? And we're like, sure. And so without the health department, they're one of our, we have been strong partners all along. The coalition itself, though, and so they've been at the table. And it's really a we are at the table. Somebody needs to kind of say, okay, come to the table. But we have major support from the business community, from the chamber. In fact, so whatever day the 5th is that Monday? It is Monday. They are going to push out a whole content to all of the members about the Pump Act. They're going to say, this is what's important, this is how it's done, and it's going to link to the toolkit that's been developed by Dr. Nandi Marshall. So that's just one example. Obviously, the YMCA in the nonprofit community coming on as fiscal agent for this is just huge, because we wouldn't have been able to do it without them. But we have small nonprofits that come to the table. We have a partner steering committee that meets every other month that we are always working together in those key stakeholders meetings. It's the developing of the relationships that's really important at every turn. It doesn't matter what it is. It's like, even Leopold's Ice Cream down on Broughton Street is listed as a partner on the Healthy Savannah website, because he once was way overweight and found a way to become a healthy weight. And he wants everything, he wants a culture of health in our community as well. So it's just building those, the same thing with the mayor and the aldermen and the commissioners and the chair of the commission, just have to stay in contact with them, and we do. And it's like every time we call them, it's not something we want. We go to the meetings and support other organizations that are, again, bringing culturally tailored solutions to the table, and to do that. So did that answer your question? Okay, cool.
And Paula, just great to hear you describe in particular the partnership that you have with health departments, for example, you know, as an entity in the community, but also just the breadth of partners that you have. You know, Dr. Peterson highlighted how the grantees, that's really such a core component of this, is you're not doing this work alone, but really have those key partnerships. But great to hear a local health department engagement as well.
Thank you.
Madison, other questions from the audience?
Yes, this next question will be for Dr. Peterson. Could you discuss the use of research in creating these programs and interventions, and how you utilize research to continuously improve the program?
Yeah, great question. So research is the basis of every strategy that we do. So we are not funded particularly to do research around picking strategies. We depend on NIH and others and academic centers to create this body of research. And then we also depend on people like the Community Guide. If you're not familiar with the Community Guide, they basically take research that has a particular public health strategy that will lead to improvement and let us know if it's strong enough data for us to implement it across the country. And also the USPSTF guidelines, the Preventive Services Task Force, from a clinical standpoint with our Family Healthy Weight program, we actually wait for huge guidelines like that from scientific people who have pulled together evidence from lots of research to design what our strategies are, because we want to make sure that we are implementing something, even being culturally tailored, that's based in evidence. And I will say that as far as do we use that research strategy then to look at our impact, we are actually looking at how much impact we have through reach, because we already know those strategies will be effective. So for instance, with sidewalks and bike lanes, if you build them, we know people will come. We know people will get more access to physical activity. If you provide fresh fruits and vegetables at a low cost in a local environment where people can access them, we know people will eat them. And we know increased fruits and vegetables, and we know increased physical activity leads to the reduction in disparities and increased health. So we don't have to keep proving it. What we have to show is the implementation science of it. We need to know those levers that each community or state needs, and we need to know the policies and the systems and the environments that will make the healthy choice the easy choice. We've learned a lot in decades. It's not about just telling people what to do. It's making their environment support the healthy choice by, and we've said that many times, have the healthy choice be the easy choice. That's all based in research.
And I could add here too, I think that the, we have, I forgot to mention it earlier during the presentation, but the CDC asked us to report our leveraged funds every year. So we have X number of dollars through the REACH funding, but our leveraged funds are just out of the world. And especially in that physical activity space right now, we have recently been able to support the hotel motel tax increase. The city has hired a full-time staff planner for Tied to Town, and are ready and have people at our Savannah Chatham Food Policy Council and on it to help support moving forward in those areas as well. So it's just, the leverage funds is just amazing. What we can do with what we receive just exponentially grows.
That is fantastic. Thank you so much for sharing. Paula, this next question is for you. Are there strategies that you implement through your program that are more difficult sometimes to implement? And how do you choose what interventions are most needed for the community?
That's a really good question. So yeah, this is a tough one. But I will tell you, we before REACH, we probably had what should have been our most difficult policy change, and that's the reason we didn't select the tobacco strategy is because we passed a smoke-free air ordinance in the city of Savannah in it was implemented January 1st, 2011. And of course, Dr. Peterson, Dr. Gracia know what happens when you have strong smoke-free air. It's just the deaths and death rates due to heart attack and heart disease just plummet. And that's what's happened in Chatham County. And then others have followed. So that was, it was a one, but it didn't take long. It was less than a year to actually get it passed and implement it. But then we just was talking about easy. Our campaign was called Breathe Easy. And so it has worked. However, we also went to the county with a complete street, or the city with a complete streets policy. And of course, everybody picked it apart and so at the very end, what they were willing to vote on, we weren't willing to compromise. So we pulled it off the table, and we've done a lot of work with them on the education of what complete streets are. And those of you on the call here that don't know what a complete street is, I think it's just a crime that we have to call it a complete street. A complete street should have sidewalks. It should have cross lanes. It should have, signals. It should have sidewalks and bike lanes. It should have all of those things if we're considering all people for everything. But too many of our streets, in fact, 73% of the streets in Savannah don't have a sidewalk on either side. And that's just something that no one would think about the city of Savannah unless I said that here, but it was a full mapping done. So trying to get that complete streets policy passed, it has not happened yet, but have faith. We're still working on it.
Thank you, Paula. And Complete Streets is a policy that TFAH also advocates for. So really appreciate what you're trying to do in your community around Complete Streets. I think we have time just for one more question, and I'm going to ask Paula. It may not be a brief one, but I think it's an important message because you've said it as to the value of what this grant is really helping to bring into community. And you heard early in our discussion that there are proposals that would actually decrease REACH's funding. The current House Labor HHS appropriations bill would actually reduce that funding by $6 million, which would mean about $110,000 of cuts to all of the current recipients. Can you describe for us what would that mean in terms of your programming and what you're doing in Chatham?
Well, I don't even want, I can hardly think about it. You saw those young folks early on that have passion for bringing forth a culture of health in the community. And that money per year would undercut 2 of those people, period. So it just wouldn't. And so we are grateful for what we do get, because before it wasn't all of us, but we have all of us, and we're making such huge impacts, and we can do more, but cutting the resources is not the way to do it. It's the long game, because policy and systems doesn't come overnight. It never has. And we understand that, but we are here willing to do the work. Just, we need the funding to support it.
Thank you, Paula. Appreciate that perspective. Thank you, Dr. Peterson, for sharing with us the history and just amazing impact of REACH over these past 25 years. This important milestone anniversary for the REACH program. As she stated, it's proven strategies that they know what works, and it's culturally tailored in communities to really respond to the community needs. It's been so wonderful to hear about these impactful achievements of the program. And commemorating this milestone is such a great opportunity really to uplift the program, but also to spur us to continue to take action to support the REACH program. And so in closing, I want to say thank you. Thank you to our panelists. Thank you to all of you in the audience for your interest in this program and what you're already doing in your communities. I also want to thank AI Media Captioning Service, Keystone Interpreting, and our TFAH staff who are supporting this webinar. Clearly, this is an issue that we know is so critical to reducing disparities, improving health, and ensuring that everyone has the opportunity to be as healthy as possible. A recording of this webinar, along with the slides and additional resources, are going to be available on our website at tfa.org in the coming days. So please be on the lookout for that. Again, we thank you. Thank you for joining us to commemorate this 25th anniversary of the Racial and Ethnic Approaches to Community Health program, and many, many more years to the impact that this program will have in communities across the country. Thanks, everyone. Take care.